Welcome back, everybody. For those new, my name is Brian, and I'm a doctor and a sports fan, and this channel is your #1 destination for learning about everything related to sports medicine news and sports injuries. This video is going to be the first episode of what I hope to become a weekly series here on this channel. While there's certainly a lot of major injuries and sports medicine news that comes up throughout the week in the different leagues, there's also a lot of smaller stories that I really want to share some information with you guys about, but don't necessarily have all the detail for a full standalone video. So what I want this to be is a weekly series where I take a number of topics that have happened in the past week that I haven't done individual videos on, and still give you guys a breakdown of what's going on and try to get some highlights of different educational points. I hope you guys really enjoy this because it's going to give me a chance to cover multiple different sports and multiple different types of injuries and sports medicine related news that previously I didn't really feel like was appropriate for a single video. I'll be doing updates to previous injury videos that I've already done if we've had new information, and I'll be talking about any sort of new smaller story that might have come up that hasn't had its own video. Work with me here early on, leave me some comments and feedback what you guys like about this style as I try to kind of figure out the graphics, the best way to present this and go through it. I'll try to have a timeline in the description as well as something up here on the screen so you guys can kind of see where I'm at in the different storylines. But enough talking, let's jump right into this first episode. We're going to be talking about NFL, Sam Darnold, baseball injuries, particularly with Christian Yelich and what happened with Mike Trout's foot, and some other pretty cool stories that have happened recently in sports. Don't forget, of course, to go subscribe as always if you like this content and want to stay up to date, and let's get started. Let's start off with one of the biggest topics in the NFL, and that is of Sam Darnold missing the upcoming week and potentially more time with mono. Mononucleosis is a viral infection caused by the Epstein-Barr virus. The three main symptoms we see with mono are fever, sore throat, and swollen lymph nodes. And of course, you've probably heard about how mono is considered the kissing disease. That virus gets spread in the respiratory and the salivary secretions, and so yes, you can get mono from kissing someone and being exposed to the saliva of a person who has mono. But it can also be transferred from getting exposed to a sneeze or a cough or just drinking out of the same glass or cup as someone who has it. Most people who get mono are young, and you've probably heard of having mono like in high school or middle school and just being totally zonked out for a number of weeks with super bad fatigue. But there's one other important thing that happens with mono that's especially important for a football player. Whenever you have mono, these lymphocytes that are part of the white blood cells in the immune system amplify and sort of build up and collect in your body in the spleen. We pack all these lymphocytes into the spleen, and that causes the spleen to stretch and get bigger and makes the spleen more susceptible to getting injured. Your spleen is extremely vascularized with blood vessels, and so an injury to the spleen can be life-threatening. So while someone who is in the early stages of mono is probably not going to feel like playing professional football because of all the fatigue and flu-like symptoms, the actual long-term danger is the life-threatening risk of a spleen rupture. Having a big spleen is kind of the norm whenever someone has mono. This isn't a rare thing that happens and is really the reason why they're probably holding Darnold out. The challenging piece of trying to figure out when he'll be back is because of this prolonged risk of spleen rupture. It's actually a little bit delayed from the time you start getting symptoms until the spleen is most susceptible to getting ruptured, and it's most often in kind of the 7 to 21 day time frame where the spleen is most susceptible. But even if someone feels really well and their energy is back and all their symptoms are gone, if it's still before that time frame, you still have a big spleen and there's a risk of it getting injured. A lot of times in young high school kids, college kids, middle school, whatever, we recommend abstinence from sports of 6 weeks. In the NFL, of course, there's a little bit of room to do more diagnostic testing, and so sometimes they'll do an ultrasound of the spleen to monitor how big it is. But don't be surprised if Darnold misses significant time here. Even if his spleen comes down in size and he's able to get back quicker, the fatigue of mono can really last for weeks, if not months. And just by the way, it's kind of impossible to figure out who gave him mono because the incubation time period's like a month long. And so he probably got exposed to it at least a month ago, and it's really hard to remember everything you were doing at that time. Following up a video I did last week talking about Antonio Brown and this question going around social media that I saw about whether or not he had CTE. Of course, after I posted this video, we found out he was getting signed with the Patriots, and all this information was released about how this was just an orchestrated kind of social media ploy to get him to the Patriots or off of the Raiders. And so I do think we have to kind of look at the whole situation through that lens. I appreciate the feedback I got with this video, and for everybody who thought it was more negative and improper to talk about, I do think once we have an actual test for CTE, this is going to be a really important question to ask our athletes. If we see someone who's had repetitive head injuries and is displaying symptoms and we have a diagnostic test, then we really are going to wonder and ask this question of whether or not people have this condition. Probably not at that stage yet, but definitely something in the coming years. I think we're going to have a good diagnostic test and a really good way of, at least clinically, determining what's going on and what's causing it at what stage. Staying in the NFL, the theme of week 1 seemed to involve clavicle injuries. We saw Nick Foles fracture his clavicle and ultimately have to undergo surgery. Tyreek Hill had an SC joint dislocation, which I covered in a previous video. Devin Funchess of the Colts fractured his clavicle. And so we saw a crazy number of these injuries just in week 1. I want to quickly highlight the key points to think about with a clavicle fracture and how they decide if someone needs to have surgery or not. We can divide the clavicle into 3 different regions. You have the middle third, the lateral or the outer third closest to the shoulder, and then the proximal third that's closest to the breastbone. The most common place we see fractures in adults is this middle third, and it's for a couple of reasons. The first being it's the thinnest part of the clavicle, and it's also the part of the clavicle that's where the curve sort of has a transition point, which mechanically makes it more susceptible to injury. There's also not as many ligamentous attachments and muscles here to help provide additional support, so we most often see fractures here. The next most common are out by the shoulder, and then finally the rarest ones are in by the sternum. The exact management of clavicle fractures isn't exactly as consistent as you might think. There's a big debate between whether or not you should operate and do a fixation, or if you can just let things heal conservatively. In general though, the basic rule for these fractures in the middle part of the clavicle is how much displacement there is and how much shortening or how much overlap whenever the clavicle breaks and then kind of overlaps on top of itself. Certainly if there's a lot of displacement and shortening of the clavicle, doing surgical repair is probably going to give you a better outcome based on research. But if it's just a tiny fracture where there's no displacement, there's no shortening, the return to play period is actually pretty much the same from a research standpoint based on previous studies. Nick Foles is expected to miss around 10 to 12 weeks, potentially returning in week 11, and this would line up with what the data tells us. They really need to make sure that he's got demonstrated bone healing both on an x-ray and clinically is having no pain and no symptoms, and has full range of motion back in his shoulder. Watch out for these though. Anytime you see someone land on the outside of the shoulder like we saw with Nick Foles, the clavicle is the big thing you got to think about, whether it's the bone itself or the AC joint at the shoulder, or like Tyreek Hill, the SC joint at the sternum. A quick update about Patrick Mahomes. I of course covered his ankle sprain in a previous video last week, talking about how the particular mechanism looked consistent with a high ankle sprain. It seems like so far he's doing pretty well. The Chiefs have released some news that so far it seems like everything's a go for him to play this week. While this is awesome news, we have to keep in mind that whenever someone returns to play, that doesn't mean that structurally that tissue is back to normal and completely healed. There's a delayed time course between when someone feels good and is functionally ready to go and when that tissue is completely healed. So even if we see Mahomes return this week, it's important to know that that ligament that was sprained is still more susceptible to getting injured as it would have been a week or two before this. It takes much, much longer for ligaments to completely heal compared to the duration of symptoms and what he can functionally do. Changing sports here and moving on to the NBA, I want to talk about a really quick update with something we saw this past week about Kevin Durant. If you guys saw it, I'll post the link below, but he essentially did a live stream interview with someone on YouTube, and towards the end, he changed his phone angle and he showed that he was walking outside with no brace, no boot, no crutches, nothing. He was just walking in his shoes, and even at his shoes, it looked like untied. This is phenomenal news. I certainly think that Durant seems to be at least on schedule, if not ahead of schedule with his rehab progression, just based on the fact that the season hasn't even started yet, and he's already walking without any sort of brace, boot, or crutches. This is really reassuring and promising for the rest of his rehab. Now, I will tease, I've been working on a video about Durant's rehab progression, and based on some of the evidence out there, I think it's pretty safe to say that if the Nets are in a good position, we could definitely see Durant come back at the end of next season in time for the playoffs. So you guys asked for a lot of baseball videos, and I hate to say I haven't done really any except for a long time ago, but there was some big news in baseball recently, starting off with Christian Yelich fracturing his patella. We rarely see patella fractures in sports just because it's such an odd, uncommon place to really take that high of an impact, but if you foul a ball directly off your kneecap, you're going to subject it to a lot of load and risk of fracturing. The patella is what we call a sesamoid bone, and it's the largest sesamoid bone in the body. These are bones that live sort of inside of a tendon. So the patella is inside in between your quadriceps tendon and your patellar tendon. The initial word is that Yelich is not going to have surgery, and really the only reason he's out for the rest of the year is just because of the timing with how late we are in the season. One of the big decision points for whether or not these injuries require surgery is whether or not you have an intact extensor mechanism. So the extensor mechanism in your leg is the ability to activate your quadriceps and extend or straighten your knee. If you have a patellar fracture and you are unable to do that, most of the time you're gonna have to have surgery just because of how severe it is. But if there's just a fracture there, you're able to walk, as we saw Yelich was, oftentimes these heal up pretty well with just rest and keeping that leg in a knee extended position to allow those bones to stay lined up and completely heal. As long as they're diligent about making sure he maintains his quad strength, his hamstring strength, range of motion, and so on, I wouldn't expect this to really cause long-term problems and would expect him to be fully back and ready for the upcoming next season. Mike Trout is on track to win the MVP award this year, and as you might have expected, like most of us, he's pretty terrified of needles. Trout was diagnosed with something called a Morton Neuroma. He ultimately had to miss some time as they did something called a cryoablation procedure to try to help treat this condition. Within our hands and within our feet, we have these nerves that branch out to provide the sensation along our fingers and along our toes. We call these digital nerves or interdigital nerves. In the case of a Morton Neuroma, the nerves that are going between the toes get damaged or injured in a way that causes this fibrosis and this scarring to build up around the nerve and ultimately sort of compress or squeeze it. Sometimes there's compression from the ligaments that run between the joints of the toe bones, but think of these Morton neuromas as basically fibrosis and this buildup of kind of fibrotic tissue around the outside layer of the nerve, causing it to get pinched and cause pain. What they do with the cryoablation is they take this big long needle, they stick it in right along where that nerve is, and they usually infiltrate it with a specific type of gas that causes that area to get really, really cold. This cold temperature kills the nerve essentially, which causes it to be unable to transmit that pain signal back up to the body. Now, this isn't a definitive treatment, and there's a lot of times when we do procedures like this and it either comes back or it doesn't completely take care of things. So we'll have to follow along here and see whether or not this totally resolves his symptoms. If it's unable to fix everything that's going on, they'll go in and potentially do a resection where they actually cut open the skin and cut out that piece of the nerve that's causing the pinching and causing that pain. But assuming they take care of it okay and he gets back with no pain, I would not expect any implications for the rest of the season. The Chicago Cubs are making their postseason push, but are currently without one of their star players, Javier Baez. Baez is out with a fracture in his thumb, and specifically what we heard was that he had an intact UCL ligament, but an avulsion fracture in the thumb. Our thumb joint has ligaments that run on the outside of the joint, just like our LCL and our MCL in the knee, that help provide stability kind of in a side-to-side direction inside that joint. In particular, the one that's on the ulnar side or the inside of the thumb, we call the UCL or the ulnar collateral ligament of the thumb. If that ligament gets stretched in such a way that pulls on it with enough force, it can either tear itself or it can cause a piece of the bone to get pulled off, which is what's considered an avulsion injury. A piece of the bone avulses off of the rest of the finger bone. The mechanism of when this happened with Baez is pretty classic. It was when he was sliding into base and that thumb just got caught and jammed and it pulls the thumb out to the side, which stresses that ligament and causes the injury. This is a little bit similar to what might have been going on with Kyle Lowry in the NBA playoffs if you were following and he had his thumb injury. But of course, different levels of severity in terms of what's going on and what you can do while it's healing. The thing we have to watch for in these types of injuries though is something called a Sutterer lesion. In that area of the UCL, there's a specific muscle inserting called your adductor pollicis. It's the muscle that pulls your thumb in towards the rest of the hand. And if that UCL ligament gets injured, sometimes that tendon of the muscle can sort of get stuck in the way of that ligament and prevent it from healing. The news we have about the UCL being intact sounds reassuring that hopefully he's at low risk for something like this happening, but if that does develop, usually they have to have surgery to actually get it fixed so that that ligament can heal. There's hope if the Cubs make the playoffs that Baez will be able to return in time, but certainly the season could be in jeopardy if they don't. Rounding out the week here, finishing off in baseball with news about pitcher Michael Pineda, specifically his suspension for taking a substance called hydrochlorothiazide. Hydrochlorothiazide is a diuretic. It's a medicine that acts on the cells in the kidneys to help your body expel and lose more water. The reason that it's on the banned substance list is because sometimes these diuretics can mask or hide the use of other actual performance-enhancing drugs. Nothing about hydrochlorothiazide is performance-enhancing. It's simply a masking agent that can affect the testing results for other medications. He got suspended for 60 games, and the particular thing I thought was kind of odd about this story was he claimed that it was from an over-the-counter supplement that he was given for weight loss. Diuretics and different natural substances that act as diuretics are commonly sold as over-the-counter weight loss medications, One big one is dandelion root, for example. But hydrochlorothiazide is not an over-the-counter available medication. It's something that you have to have a prescription for. So either some company was illegally putting hydrochlorothiazide in their over-the-counter diuretic pills, or he actually had a prescription for it and just wasn't telling the whole story. So let me know what you guys thought about this format in the comment section below. I'm gonna try to be consistent with doing these at the end of the week once we've had a chance to kind of get news about injuries from football the previous weekend and get updates about things I might have done videos that weekend and so on. It's certainly gonna be longer, but hopefully you can skip around if there's particular things you wanna learn about. And I think this will give us a chance to talk about more things, learn about more stuff, and overall have a much better experience here. Thanks as always though for watching everybody, and we'll see you in the next video.